Okay, so I'm going to bore you for a second with who I am and what all this is all about. My name is Isaac Osborne. I'm a structural integration practitioner, massage therapist. Structural integration, you might have heard of Rolfing. That's been my background for the last 23 years. And I branded these massage guns because during the pandemic, I needed something to help my clients out over Zoom because I couldn't put my hands on them. So that's why it's called the integrator. After structural integration, it's a form of body work that focuses on joint alignment, muscle coordination patterns, and so forth. So what we're going to be working on today is neck pain and back pain, and I'm going to highlight areas that are the most common areas that people have that are really, really tight. And the whole idea behind this is that the vibration, there's two main things that muscles respond to is vibration and pressure. So those vibration and pressure, the muscle will release and relax. The other thing that we want to think about is that muscles work in coordination with each other. And so for instance, people with neck pain, people with back pain, the most common area that is actually really, really tight on people is actually the abdominal region. And the abdominal region has, whenever stability in the hips is thrown off, maybe you have one hip stronger than the other hip or so forth, then the abdominal region actually contracts really hard to make up for the loss of those muscles that are not working in the hip. So that's where we're going to start today. We're going to actually start working to release the obliques, and there's two major areas that we want to release. We're going to release from the side here and this area right in here. This is called the costal arch. And this area is really specific for actually releasing the neck. The side here is really specific for releasing the low back. So what we'll do is we're going to go from this area. We're going to be lying on the ground. We're going to be working with the hips as well. And there's a couple major areas that we want to hit in the hips to be able to release the back. And then we're going to work in the shoulders and the arms and some in the neck to release the neck. So does anybody have any neck pain or back pain today? Just tight, really tight. Is it severe pain or just tight? Just tight, okay. So you might want to pay attention to, before we start, what your range of motion is, what the stiffness feels like in the neck. Take a little baseline of that, and then at the end, we'll check in with that and see where we are. Okay, so for the first one, let me take my shoes off. Like I said, we want the soft head attachment. And then I'm going to lie down right here in the middle so everyone can see me. So a lot of the stuff that I do is lying down because it's more supportive of the spine. So ideally we'd all have pillows. I don't know if we have pillows or blocks or anything like that. Like yoga blocks would be perfect.
Do you need help, Kayla?
You got it? Thank you so much.
You got it.
Looks like she's done this before.
So let's have everybody lie down, and before you go, there's this bone right here. There's a hip bone here, and there's this bone right here, and then your rib cage up here. So you want to find that bone. Everyone feel it right there on the side of the hip?
The low rib?
Yeah. So it would be this bone here, that one, right there. That's the top of your pelvis. Yeah, you got it. Bingo. It would be that bone right there. Feel like you got it? Yep, you definitely got it. Yep. Okay. So that's your that's a point of reference for you. And what you want to do is you want to take the massage gun and turn it on and get it on a low speed. So the low speed is critical because the low speed is going to be more relaxing for the muscle, and you want to just let the weight of the massage gun kind of stay on there. That way you're not pressing really hard or creating a lot of tension in your body. And that bone, you want to be just above that bone. And then you're going to hang out on a spot roughly 15, 30 seconds or so. You can hang out more than that, but we're going to kind of move around, and you're going to move around to kind of the front, and then you kind of move around back to the back. You can do continuous movement, or you stop, find a kind of like a little sensitive spot, and then move around that area again.
Do I have the right spot here?
Yep, yep,
This bone,
yep. There's the bone right there.
and then,
If you bring this knee up, this one, the bottom one,
oh,
there, it'll actually support the hips a little bit better. And then, yes, right there.
right there, the
Yeah,
middle, the
yeah.
middle line.
Yeah, you may not be feeling a lot of sensitivity, but that doesn't mean we're not releasing a muscle. No, that's, you can actually, you're going to get, you can't really reach the psoas really well, but vibration going down into the psoas can release from here. So you're not pinpointing right on top because there's a lot of muscles, the layers of muscles on top of it, but it's going to get it kind of through that just a little bit. How's it feel? Feel good? How's it feel? It's relaxing, right? Itchy can be a histamine release sometimes, or it can be actual release of tissue changing. So if you haven't moved around a little bit, go ahead and move a little bit more towards the back side. You're going to go, if you're going to go forward in the front, you're going to go right about, just kind of right about there. You can feel the front of that bone right there. Just right about there is a good spot. It's really safe as well in this position to have something going into your abdomen because all your organs are actually down at the bottom towards the floor. So you're not going to be pressing into your organs. So you can change the angle of it in different spots. You can angle up towards the rib cage. You can angle down towards the pelvis. And the reason why this area is such a great area is because all those abdominal muscles intersect here and attach on top of the pelvis. So you're actually getting many different layers of muscles. And like we were saying over here, you're even getting a vibration effect down into the psoas muscle, the deep, deep psoas muscle, that muscle that lies on the front of the spine. Okay, so now we have that reference point of that bone here, the top of the pelvis. We were just above it. Now we're going to go below it. So now we're going on to the hip. So on the hip bone, if you go down a little bit, you'll feel the hip bone right there. So where we were, in between that spot at the top of the hip bone there and there, that's the area you want to be in between. So here's your hip bone, here's the top of your pelvis. So in between that area there. Yep. Perfect. Yep. Yep. So that area, if you think about that hip bone as that centerpiece, and if you want to draw a circle all the way around it, you're going to get all these muscles, the hip flexors, secondary hip flexors. You're going to get these abductors. You're going to get the glutes. All these muscles around the hip, and these are really, really important to release for the function of your hips, one, but two, your sacrum, the base of your spine. So the base of the spine, everyone knows about the sacrum? Everyone know what that is? So imagine a triangle here, like this. And from here, there's a bunch of muscles that come across and attach to that triangle. And so by coming around the side in this area, you're going to get all those muscles in that triangle on this particular side if you're working on this side. So you just want to hang out there and then go around and then come back around. We're going to hit it a few times. If you don't feel like the vibration is enough, this is a very dense area of musculature, go ahead and increase the vibration. And again, you can put a little pressure on there, but one of the things that I always say about this, you're not trying to kill it, right? You're not trying to kill it. I've had people bruise themselves with this thing. That's not beneficial because you're creating adhesions if you bruise it. And so the idea is if it doesn't release, it's not releasing for a reason. And if it's not releasing for a reason, this is where we go somewhere else in the body to release it. Because like I said earlier, muscles work in groups. They work in coordination with each other. And if one muscle's not releasing, that means a muscle somewhere else is not doing its job. So we don't want to release that muscle until we release everywhere else. and things will then fall into place. How's that feeling? Good? Is that the hip that was replaced? It was the other side. The other side. We'll get there. So think about this too. Who has a tight IT band? Everybody in the world, right? Okay, so the IT band, what the IT band is a tendon, not a muscle. So the area that the IT band attaches to or originates from are two muscles here on the side of the hip and comes into the IT band here and goes all the way down to your lower leg. These muscles are tensor fasciae lata and gluteus maximus. So by going around the hip here, you're actually releasing the muscles that will free up your IT band. So we want the IT band to be free, obviously, and this is a great way to do it.
Mine just died.
Oh no. Your IT band. Here, use this one. Here, use this.
Okay, thank you.
You're welcome. Can I use that one just to demo? I don't have to have it on.
Which
Yeah.
one? Which this tip?
Yeah, that's fine. Thank you. Okay. All right. So now what we're going to do is we're going to switch sides. So let's everybody, let's switch sides. Everyone good so far? So what I want you to remember on that other side, and we're going to start where we started on the other side, is just above that pelvic bone. We're working the obliques, working the transverse abdominis, and it's sort of getting the rectus abdominis by getting these other muscles, but not really. You're going to work in there. So now, question for you. On this side, is it the same? Is it the same tension on this side that there was on the other side? Is it looser? Is it tighter? Is it more sore? Those are the kind of questions you want to ask yourself, because it's really simple, right? That if it is more sore and tight, then you're probably overusing this side more than the other side. So you want, if that's the case, you might want to spend a little bit more time on this side when you're doing this on your own. Sometimes, like for you, like you're going to get a good stretch in this in here with the leg there. But if for whatever reason it doesn't feel like it's releasing, then I would stack your leg. Or if you're up in this area, up in here, higher up, and that leg, because that will change the pelvic position. So stack it or bring it down. You can change it, like play with it, experiment with it. Like, do you get a little bit more release when the legs are stacked up? Like for you, it was too tight to have the legs over, right? And then when we stacked it up, we got a little bit more release in there. Any questions so far? Is this the best class ever? You just get to lay on the floor and then use a massage gun? Okay, so these muscles, the obliques, they wrap all the way around from the back all the way around to the front. And so by just releasing this area here on the side, we get to a good amount of them. But again, you can go through the front, and then you can also go all the way to the back. You can come close to the spine even if you want in this area. So it's a really safe way to get back there towards the spine with the muscles relaxed as well. My typical rule of the spine, when you're working on the spine, I want you to think about the angle of the massage gun. So a lot of people when they work on the spine, they'll take the angle of the gun and they'll push directly into their spine like this. Not the best idea. So what you want is think about an angle, like maybe like a 45 degree or an 80 degree angle like this towards the spine. And when you have that angle, what's happening is it's going across the tissue back there. And when we go across the tissue, we go what's called cross fiber. It's like It's like combing it open. It's like having all these fibers and it comes across the fibers and these fibers open up like this. And when the fibers open up, the muscle will relax and release. But when we press directly into the spine, since this is a device of percussion, it could be hammering on the joints of the spine and it can make it very sore. So you want to be careful. Did it die? Go ahead and turn it back on. Yeah.
Oh.
I charged it. So it does, for my gun specifically, they do have a safety where if you leave it on after a certain amount of minutes, like 15, 20 minutes, they will turn off. So this one might have done that. Yeah, it did. Yeah.
But you know, it was spinning. Like, it was going,
What was it, me funky? Like, yeah. Then it might be dead.
It might be? Okay.
So let me see it.
I'll let you do whatever.
Sometimes if you just press the button once, no, it's green. See if I press like this, it's green, a green light, so it's charged.
So it's good?
Yeah, it's good.
Okay, so this one's there, so that one's yours.
Yeah.
You bought this one, I want you to keep yours.
Yeah, good. Gonna keep track of them. All right, so if you haven't moved down to the hip yet, go ahead and move down to the hip and we'll get around that trochanter of the hip.
It's jumping?
Oh, yeah, you're
It
right.
needs to be charged.
Yeah, it needs to be charged. Yeah, that's weird. You don't have to charge them that often. They last a long time.
Since you bought it? Okay, yeah, generally when you first get it, it's good to just
Okay, so go ahead and go around that hip. You can really get those areas. So you can, the glutes as well. Can I guide the gun a little bit? Go ahead and keep a hold of it. And then you want to go like feel this area right there. That's a great spot for your hip. Well, there's a lot of the sciatica for sure. That's where the sciatic nerve is, but we're going for a lot of different muscles that are
not getting
deep.
this guy to turn on all of a sudden. What am I doing wrong?
Oh, it's on. Those two lights. You just hit.
Oh, okay. I was like, why is this not?
Yeah, that one's a little tricky. Yeah, so all around. So if you just kind of like hang out there and then hold like an angle there or hold an angle there. And then kind of let the weight of your hand settle into it. And then you can come back here. Like that spot's a good spot for you right there.
Yeah, but, like, I mean, some stuff I like.
Any good to use this on the IT band?
Nope.
Because it's a tendon, like
No.
rolling.
So-
rolling, it doesn't do any good.
Doesn't do any good. Yeah. So where you want to use this? This is a great question, you guys. This is a great question. So she asked, it doesn't do any really good to use this on the IT band, like foam rolling the IT band? No, not really. However, what you can do with the massage gun is the IT band, right? It comes like this. It's like this here. And there's this spot right here that goes behind the IT band. And getting behind the IT band can be really, really beneficial because it can create a lot of adhesions back here. And so you can get behind the IT band and go up and down in that area, and that feels really good. And that will actually release. Do you know another one? How you doing?
Hey,
I'm Isaac.
Daniel.
Nice to meet you, Daniel. Here, you can use this one. Oh, no, this is the one that's not
that was
working.
the one that was-
Just grab a mini from out of there.
Okay.
So you can go all the way down the back of the leg here. And that actually is getting a couple different points. You're getting behind the big quad muscle. You're getting on the side of a hamstring muscle. You can hang out right here if you want. Get this out of the way. You want to use this? I'll put it right here. There you go. So it can be a great release. You actually get a multiple muscles. You're feeling it right there, huh? So you get hamstrings, you get the quad, you get all those muscles in that area. Which most people have really tight hamstrings. So it's a really great area. If you want a really quick release of the hamstrings, that's a great spot to hit right back there. So behind that IT band. All right. Let's give it one more minute here, and then we're going to switch. We could be here all day, for sure. So what you missed was there's a bone right here. What Well, yeah, we're gonna get this is like a landmark here, and then your trochanter is a landmark. So you know all this stuff?
Yeah.
Are you a trainer?
No, I'm studying nursing.
Oh, cool. So, yeah, just think about like all the deep six, glutes, and you want to go around the trochanter, and then you go behind back here. Yeah. Awesome, you guys. Okay. So now, I think this is yours, right? So, I'm just going to use your attachment here. All right, we're going to actually switch. Go ahead and turn off your guns, because the safest way to switch the attachment is obviously with the gun off. You're going to take it out and you put the fork attachment in. Yeah. Wait, you can use one of mine probably. I'm not sure, but we can definitely try it. Let's see if it fits.
I think I bought it from Peter.
Yeah.
The fork for the big gun.
I just gave mine to her, and let's see. Just grab one out of here.
You want to make sure you keep everything in order.
Yeah, I think we'll get it. Okay, so just watch me for just a second. You're gonna lie on your back like this, and this area is called the costal arch. So there's bones right here, and the bone. This is your rib cage here. So if you're gonna feel on your back, I'm gonna have you lie on your back, and you're gonna feel this area first, like this. But don't do it yet. So now you'll see that if I put my finger here in the fork attachment, imagine this is my rib cage that I'm feeling here. We're basically gonna put the fork attachment in the rib cage like this, so that it gets on the lower side of the rib cage and on the upper side of the rib cage. And make sure it's on a low speed. And then, this it needs to be charged, sorry. So while it's here, and I want you to keep your knees bent because this actually helps your spine relax more in this position. This can cause too much strain on the low back, especially if your low back is really tight. So while you're here in this position, I'll just demonstrate so everyone else can see. But you'll have your knees bent, and then you're just going to hang out here like this, and then you're going to slowly go down, and then back up to this area here. We're not going to put right in the middle because there's a little bone right here called the xiphoid process that we want to ignore. So here and down and then back up, and we're going to do that for about 1 minute to 2 minutes, and then we'll switch hands. If you're going to do the left side, you're going to hold it in your right hand. If you're going to do the right side, you're going to hold it in your left hand. This way your body will relax more on that side of the body if you're holding it with the opposite arm. Right? So this is very relaxing because it's going to release the abdominal muscles, the obliques, from another area, but it also is going to put vibration into your respiratory diaphragm and put you more into what's called a parasympathetic state, which is the rest. Are you able to bend your knees?
Yeah.
Okay.
Should
You
I,
can bend,
should I feel?
yeah, bend them a little bit more there. And then so you want to feel like right there. A little sore, huh? Like
So it's
right
going
there. So
like
there's the
this.
bone.
So half of it's on.
Yeah, and you have it. So half is it on the inside here and half is it on the outside. Yeah, yeah. So we're getting the obliques and we're also getting the respiratory diaphragm here as well. Yeah, just like that. Yeah. Good. You can go there. I only demonstrated to there, but you can go all the way down, you know. And so you just make sure you just follow that. You just follow the bone. Try to go a little bit slow. Like really relax your stomach. Yeah. So relax your stomach as much as you can. So you want to feel it like.
Am I in the right place?
Yeah, more like this. So let's turn this off for a second. And I'm going to. So in this hand, we're going to change the angle of this so that when you hold it, it's going to come, there's the bone.
Okay.
Feel how tight that muscle is right there? I'm going to turn it on. There we go. That's the spot. So now it's on the bone on this side and on the inside of the bone here, on the abdomen.
Gotcha, thank you.
Yeah. And that angle is good. Good. You got it right on the bone, huh? Yeah, yeah, right there. That's great. It hurts, huh?
Is that too high?
Yeah, that's a little high. I would go, but you're gonna feel this is a really sensitive area. Really sensitive area on people. So most of the time, is you doing good? You can feel it through your back. So you can always lighten up a little bit. So I would actually hold this. I would take the
Yeah.
and go like this, and then it will be a better angle on your arm. It will be more relaxed there. So I'm gonna turn it on, and just lightly hold it. That way you're getting the vibration, and you can ease into how much you're doing there. So how much tension you're putting on it obviously is going to be how much you're going to feel in your body, right? So the less tension, the better. So you feel this bone right here.
Yes.
We're gonna come there like that.
Up inside there.
Yeah, yeah,
Okay, so
Yeah.
here's the bone and here. Oh,
Yeah.
I see. So there's
Yeah.
some mass below it.
yep,
Yeah.
yep,
And
exactly.
I was below that.
Yeah.
Yeah.
You were down
I
here,
was yeah, I know.
which was you would still get some benefit, but it's going to be more effective here because we're getting really close. We're getting really close to the respiratory diaphragm. How's it feeling now? Is it less grabbing? Yeah, yeah. And that's a really good point that he just made there is like if you breathe into it, you can, as you inhale, that belly breath inhale, it's going to kind of push out against it and it's going to release even more. And another trick for you is when you're exhaling, try not to tighten up your stomach when you exhale, and try to slow your breathing down to about 5 to 6 seconds on the exhale. You can even count that 1,000, 2,000, 3,000, so forth. Try not to push the air out, just try to allow the air to come out. But reduce the amount of speed that the air is coming out to 6 seconds, and you'll get a very deep state of relaxation in your body. Excellent, you guys are doing great. A lot of relaxed faces here on the floor.
I have sometimes when I lean back and put this in
Uh-huh, uh-huh.
sometimes big bulge comes out. I think it's like spasm.
Oh yeah, that's a,
I just push it back in.
uh-huh. That's a spasm of the rest. Does it cramp really hard and hurt?
It doesn't really cramp.
No?
Oh, it cramps hard. It kind of hurts.
Yeah, yeah.
I'm used to it.
That's a spasm of the respiratory, not the respiratory, but the rectus abdominis muscle. So this would be really good for it. Especially, actually staying more right here would be perfect for it when it happens. After, like, while it's happening or after it happens, just lay there in that 45-degree position and just hang out here like this. Let the vibration do it. You'll feel it just sink away.
It's a thing on its own without pushing it.
Yeah, exactly.
Kind of feels like an alien.
It's like, so if you hold it like this, like grab it with that hand, let your elbow go on the ground, and then just kind of let it at that angle like there. That way you can, like, your elbow's on the ground so it kind of anchors you, and then so it's not so tiring to hold it up there. Okay, so if you haven't gone to the other side yet, let's go ahead and do the other side. Switch hands. Remember, if you're going to do the left side, we're going to use the right hand to do the left side. This is going to put you to sleep. So again, we're thinking about, okay, whatever side you did before, what did that side feel like, and what does this side feel like? It'll give you a kind of a hint of, like, again, what muscles you're potentially overusing. So you're a little low. Can I guide you? So right about there. Feel the difference of there to there. So now it's on the fork head is out now on bone side and then abdomen side.
Okay.
So yeah, and then if you kind of hold it there, and this angle, you see the difference of this angle compared to like this. That angle is going to get more of the musculature around there. Yeah, there you go.
Thank you.
So I talked about how this is affecting the back, and the way that this is affecting your neck is that, again, I talked about how when people's necks and backs, the most common area of tightness is the abdomen. And so when we let go of the abdomen, what lets go is the rib cage. And the rib cage is the root of the neck. The ribs are what essentially are the base of your neck. And when we release the rib cage, the neck doesn't have to work as hard to stack itself up on top of the rib cage. So this is how this can help your neck, is that it actually releases your rib cage. Because these muscles, they pull the rib cage down towards the ground. And if your rib cage is being pulled towards the ground, my neck goes like this. It crunches, it compresses. So the more we decompress the rib cage, the more we decompress your neck. And back to what I was saying about the parasympathetic. Parasympathetic, everyone's familiar with fight or flight, right? Parasympathetic is opposite of fight or flight. So when we put your body into a parasympathetic state, your muscles relax. Okay. You guys ready for the next one? You're going to like this one. This one's fun. We're going to keep the fork attachment here. Everyone's familiar with the collarbone. Right here, collarbone. This bone here, so everyone feel the bone, tap on that bone. And it goes out to the side here, all the way to the center right here. And so the collarbone, what we want to do is actually, again, here's the collarbone. And we want the fork attachment to kind of lay lightly over the collarbone on one side. Now, be careful here, right? We're close to your neck. Use a low speed. Don't press really hard because it'll be really sensitive. And we're going to do another thing here where we're going to do a twist at the same time. So your arms are out to the side. Your leg is going to cross over here. So my right ankle over my left knee. My arms are out to the side. I cross my hips over like this. So my right hip has gone towards the left, and my right foot is now on the ground. Now I'm going to take my left hand, and I'm going to place it on that area of just this bottom part, and make sure on your massage gun that it's not twisted like this. It's cut, the forks are vertical with the gun itself. That way, when you put it here, you're going to place the bottom one just underneath your collarbone. And then we're going to move along the bottom of the collarbone out to the shoulder and back and forth. I'll come around and definitely help you out. So low speed, you're in a twist. Yeah, you're close. So let's go like this. And hold it like that. And then here's your clavicle or your collarbone. And then you're just going to slowly go out here. Feel the difference? You're just right underneath it.
Okay. But just with one side.
Yep, just the one side. Perfect. And so, can I move this here? Like that? And then this leg here? Is that okay?
Yeah.
Okay. Oh, no problem. And that's perfect. And then you can come out to the side out here like so. And then back to the center. So what we're doing by placing you in this position, you got it. And then you're here. Ooh, that's tight.
Yes.
You let your shoulder kind of relax towards the ground. There we go, right there. Yeah, and then you stay below it. Yeah, stay below it. Don't go up on the bone. So don't go up on the bone. Stay below the bone with that bottom knob. And if this is too sensitive for you, you can definitely switch to the soft head attachment, and it will be, yeah. And if you want a little bit more stretch in there, you can bring that arm there, Think about your shoulder dropping down. Because what we're doing here is we're really opening up the pec muscle. And there's also muscles.
My hips are so tight I can't touch the ground.
You can't? So you go like this. So go here, and it's actually this way.
Oh, I'm going
Yeah,
opposite.
yeah. So do that shoulder. Yeah, yeah. How's that feeling? Good? Yep. We can change the hips though a little bit more like this, if that's okay. Is that all right? Great. So as I was saying, underneath the clavicle, there's a lot of different muscles that attach on there, specifically some deep neck muscles. So there's the bone, come right there. Feel the difference there?
Yeah.
Some deep neck muscles that attach onto the ribs underneath there. And this is like a little secret spot that it's a small area, but if we get this to open up, then it can really open up your entire neck. In fact, it will open up blood flow and nerve conduction to your entire arm if we open this up, because there's nerves and arteries that come underneath that bone down your arm. That's the problem with that one, is that it's heavy. Yeah, it's heavy.
You're saying like getting the subclavius? Is that where you're going after?
Yeah, subclavius, portions of the pec, but also underneath that it affects the scalenes, because you get scalenes on ribs 1 and 2, right underneath, right? So be careful of that area right there. Yeah, yeah. So that area right there is this area. Here's the top of your collarbone here. This area, you're getting right on some arteries and nerves and stuff. You don't want to be there. You want to be, here's your bone here. You want to be just underneath it there. See, you're pretty tight right in there.
Yeah.
So it'd be pretty light. Let me hold it for you like this.
Okay.
Yeah. Yeah, like that. Perfect. Yeah. Okay, you ready to switch sides? Okay, so let's switch sides. So now it's going to be, let's see, if you're, yeah, you got it. People did different sides, so I'm, let's see. What you can do is this. This will help a little bit with that,
I don't
the
bend
tightness in the
very
hip.
well.
Huh?
I don't bend very well.
Great. Are you able to use this hand instead of that hand?
Duh.
Yeah.
I'm like, this is a
I didn't want to assume anything. Oh, you can go all the way right there.
right there. It's
Yeah.
more tender right there.
Yeah. So if you experience like bouncing of the massage gun like this, bunk, 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 then you're pressing too hard or you're on bone. All you have to do is just kind of lighten up, or just get the gun to float a little bit more by picking it up, and then that way it won't bounce as much.
This is on one, but I feel like that's a lot faster.
A lot faster?
I mean, it
Yeah.
doesn't hurt necessarily.
If we change it to a different attachment and just go below the clavicle, it'll feel better. Because the thing is, like, you can always, my suggestions, there are purely suggestions for the tips that you're using. Always use the attachment that you're more, huh?
It's like,
Oh, did it turn off? It has an automatic stop.
I've turned it
Oh,
on and
no.
off for like 3 different times.
This one is a little tricky. You hold for like one second, and then you press again. Okay. So we're going to move on to the next spot. So now the next spot I want to demonstrate for you again. You're going to use your block. And this is really important that we release this area. And the reason why is it connects to your lats, the lat muscles. The lat muscles are directly connected to neck dysfunction. And the reason why is a lot of times people end up pulling their shoulders down this way. So this area that we're going to get, You can use whatever attachment you want. My favorite is this. So if you want to use the fork attachment, go for it. If not, then I would maybe use the flathead attachment. The pinpoint, the bullet attachment is okay in this position, but this is my favorite. So you lie on your side like this, and I'm going to release my left side. So I'm holding it in my right hand, and I'm going to place it here, right here. So my armpit is here, just on the back side of the armpit, right in this area. So we're going to get this whole area right here. So we can go back and forth like so. You can just hold it on a spot, here, 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 all this area. And watch my shoulder for a second. So this is pulling my shoulder down towards my hip. This is letting my shoulder go. So allow your shoulder to relax towards your ear. This will increase the release of these muscles in this area. This is really important. So what I suggest is that when you get down to this position, actually push your shoulder down and relax it. Push it down, relax it, so you have an idea of what it feels like to release that muscle. Here's a block for you. Yep. The more you go towards your ear, the more release you're going to get out of that muscle. We're going to release lats, a bunch of rotator cuff muscles, serratus anterior. These are all going to translate to opening up your neck. The big gun is actually the best for this one. Yeah, that looks good. How's that feel? Yeah. And then like this area right in here, like you can feel how tight that is there.
Really compensate. I got a
Yeah.
broken AC joint.
Oh, you do?
My
Yeah.
C joint's really blown.
Oh, yeah. This would be really good for you.
Yeah.
Yeah. And then, yeah, getting it to, you can even play with, feel your shoulders here.
Yeah.
You could even play with, let me move your shoulder, here. Because your shoulder, because of that break, it always wants to go that way, right? So here, I would actually release a lot into your serratus too, because that's part of this rounding.
Right.
So bringing it back and going up is really going to release all this in here. So go all the way down in that area. How's that feeling? Yeah. So feel this point right here. There it is. Feel that?
Yeah.
It's kind of like that specific. That is like a magic point right there. Yep. You got the magic point right there. Mm-hmm. What's cool about some of these points, I'm coming around and what I'm calling the magic point is this point right here. And there's a lot of muscles that cross here. And so by getting these muscles in the area that they cross, we're actually getting more bang for our buck. Like that spot right there. Right there. Feel that? All that. So it's basically, yep, you got it. That's the spot. You found it. You okay? Feels good? So the more we get all those groups of muscles to release, like I was saying earlier, that spot, the more it releases everything else. The more joints become decompressed. Right there. Yeah, right there. That's the magic spot. You're super close. Yeah, you're super, super close. You pretty much got it. You're like right there. Yeah. Go right here for the magic spot. So the other thing that happens when you release these muscles is kind of strange, but a lot of the upper ribs underneath the shoulder actually end up releasing. And so when these ribs release, then it helps improve range of motion of your neck. Because like I was saying earlier, the ribs are basically the root of the neck. And if we can get those ribs to release, then the whole neck range of motion is going to improve. We're probably going to end up going over a little bit, you guys. Is that all right? I'm glad you stayed. I hope it was. Good. She's like, I got. Is it all right if I leave early? Awesome, you guys. All right, let's go ahead and get the other side, because I know there's one muscle left that, I mean, we could go on all day long, obviously, but there's one muscle left that I want to get for you guys. It's the famous trap muscle, and I want to show you how to release that muscle. It's a great release. And we're going to use a little bit of movement to do that one. So see if you can get all those areas. Again, pay attention to the areas that were sore on the other side. See if it's sore on this side, more sore or less sore. And also see if there's different spots that weren't sore on this side than on the other side. And don't hesitate to ask questions. Close, 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 so close. There it is, yeah. This arm might feel better if it's through there like that. Is that better? It opens it up a little bit more. Maybe it doesn't feel as crunched. Yeah. Super close, right there. Yeah. So think about that's the magic spot. But then feel, yeah. You're right on it. That's perfect. But you know, there's the magic spot, but definitely don't hesitate to explore. Like right there. Looking good, man. How's it feeling? Yeah. Yeah, you went right to it. It's a little bit like right there. All right, you're right on it again. We'll come here, right there. Bingo. You can feel it right when it hits it, huh? Yeah. And then, oh yeah, you definitely can. You can definitely go down all the ribs. You can go down the whole side if you want to. But just remember, when in certain areas for certain people, you know, it's more bony than others. So if it starts jumping up and down, it's not going to feel good. You just want to lighten up on the pressure. Anytime you lighten up on the pressure, it'll stop jumping. So you can technically go over those areas with not a lot of tissue on there, but you have to hold it really light so the vibration is just barely getting to the surface. Yeah. Do I have any questions so far? Everyone's like, no, I don't have questions. I'm just going to sleep. Okay. I know we're kind of going through this, but so now go ahead and turn off your guns, and then we're going to switch it to. Make sure that I get this back. We're going to switch it to the bullet head attachment. And now this is for the trap muscle. So again, we're going to lie on our backs. I'm going to demonstrate this way. So what you're going to do is, again, opposite hands. So if I want to release my left trap, everyone knows where the trap muscle is, that muscle right here. You pinch right here and you feel it. So it's the muscle that everybody loves to massage. So what we want to do is have the bullet attachment. You're going to come down. What I don't want you doing is pressing towards your body. I want you to angle it more towards the ground. So if this is the trap muscle here, I'm on the inside of it, angling it towards the ground like this. Don't press towards your body. So you can kind of trap it. You're going to press down this way, and you're going to trap it towards the ground. And then what you're going to do is this. You're going to take your head and you rotate it slowly towards it and then back. Doesn't have to be a big range of motion. Towards it and back. And what we're doing as we do this, it's not a big area. I'll definitely come around and help you guys out. But it's not a big area that we're hitting because it's not I don't know, I lost the words there, but whatever. Just don't press towards the ground. You're going to do a small rotation. We're trapping the muscle. We're lengthening the muscle as we turn our head towards the massage gun on if we're on the left side. So if we're turning here, and it's lengthening the muscle and it's trapping it and pressing it towards the ground.
If you went like this, can I borrow the other one?
Of course.
I didn't know.
Yeah. Yeah. That one's pretty pointy. So if you want to, oh yeah, go ahead. Yeah, use that one. Let's see. This goes back to you. Was it that one?
Yeah.
There's that one too.
Because I took.
Oh, okay. Did you get one? Oh, you got one. Oh yeah. You need one. That's what it was. There we go. Okay, make sure you bend your knees. That way your spine is in a more neutral position. And then I'm going to place this here. Was that one right?
This one belongs to you.
This one goes in this one?
That was mine.
Yeah, got it. So go right here. So here's your trap muscle here. Feel that one? Mm-hmm. So that's your trap muscle right there. Oh. So now, oh, there's your necklace. So right about there, you're gonna kind of push towards the ground at that angle. That's towards your body. Feels weird, right? That is much, much safer right there. And you press there, and then small rotations with your head towards the massage gun. Yep. That's a good angle. Any more this way, you'd be getting into nerves and stuff, so be careful with that. Yeah, that's a good angle. Feels good? And so think about small rotations with your head. That's perfect. How does it feel?
It's because I feel like I'm pushing that.
You're pushing it towards the ground. You
Yeah.
can feel it, right? It's like caught on it.
Yeah. Like
Yeah.
It's almost like there's an indentation.
Yeah, exactly.
And then you want your head to go toward it?
Yep. You want to think about hearing your hair, kind of the sound of your hair move on the ground. You got it. So I would maybe go a little bit more like that.
That's on bone.
Oh. Right there.
Oh, okay.
Yeah, right there. That looks good. How's that feeling?
It feels good.
Yeah. And then yeah. So you just have to be careful of how much you're pressing. So let's go. That's going right into nerves and stuff right there.
Okay.
So you want to think about if I pinch here. That.
Oh, okay.
Yeah. That's it. Yep. So think about this right here. Right there.
Right.
Yeah.
Okay.
That's the spot. Yeah. It'll kind of catch it right on the edge of the trap, like right there. Yeah, there you go. How you let your shoulder go back.
Right.
There you go, right there. You just don't want to go that direction.
Okay.
Yeah. Yeah, that looks good. I would say more right about there. You can even angle it here like this. There, you feel how it catches it right there? And now slightly turn towards it.
So a little bit higher up.
Yeah. Yeah, well, it's actually okay because you're not on the thoracic outlet. So here's your trap. That would be more the angle there. It's okay because you were kind of far behind.
Yeah.
But you just don't want it like right there. You don't want to be pressing into that spot. Right there, yeah. That would be the spot right there. Awesome. And so play with that head movement. Playing with that head movement plays with the length tension relationship of that muscle. So you're lengthening the muscle, it's vibrating, it's opening it up. And then as it opens up, potentially the neck joints of the cervical spine, they're opening up. Okay, so have you guys switched sides yet? Done both sides? Let's go ahead and switch sides to the other side. So now turn this way. There we go. Yeah. Different on this side, huh?
Probably gonna end up buying one of the guns.
Sure. Seen the difference between the two sides? Yeah. Yep, right where you're. Yeah, go ahead and pinch it again. And then place it right where your thumb is. Bingo, right there. Yeah. Let's try something. Can you lift your head up for a second and then remove this and then let your head drop to the ground? You'll probably feel a little bit more of the muscle.
Yeah,
Yeah.
definitely.
Yeah, that was raising your head up a little too high. That looks great. How's it feel? Yeah, that one, that's the problem with the big one, is it does get a little heavy. Thank you for joining us. Awesome. Glad you enjoyed it. I'm glad you stayed the whole time. All right, you guys. We could stay here all day. But go ahead and sit up and back to where we were starting. And how does your neck feel? How does the range of motion feel? Does it feel any different? Body feel a little looser? Thank you.
If I'm having like my radial nerve, sometimes not tingles, but I know it's my nerve, and I think I have a huge knot probably in my rhomboids.
Uh-huh.
Should I focus on this one to release it, or was it more the one
It would be that one and this one.
and that one?
Yeah.
I can feel it right now, like it almost is like pinching, but not.
Yeah, yeah. That, like, radial nerve compression has a lot to do with the clavicle and how it compresses down. So, like, you'd want to release